Hello, all, and welcome to this next installment of the CalFresh Work and Community Engagement Requirement webinar series. My name is Kayla Prusha, and I am the Program Expansion Specialist for the CalFresh Employment and Training Program, and I will be leading this presentation today, along with Amy Van Meter from the CalFresh Access Unit, and Lauren Block and Becca Rosenbaum from Arera Health Group. Today's focus will be on ABAWD engagement, providing an overview of strategies and the various activities and programs for engaging ABAWDs due to the implementation of the ABAWD time limit. Before we dive in, let's take a look at what we will be going over today. First, we will have Lauren Block and Becca Rosenbaum from Arera Health Group speak about what you need to know about the changes to the work and community engagement requirements due to HR 1 and county pilots to address approaches to connecting individuals to qualifying education, work, training, and community service activities. Aurora Health Group is a national policy consulting firm based in Sacramento. Arera Health works extensively with California state agencies and counties in the Medicaid, human services, and behavioral health domains. Arera Health was contracted to support the California Health and Human Services Agency, LWDA, CDSS, and DHCS on a 7-county pilot related to HR 1. Today, Lauren Block and Becca Rosenbaum are going to share more about what you need to know about the changes due to HR 1 and the work they're doing as part of the pilot. Next, we will talk through the various ways an ABAWD subject to the time limit can meet the work and community engagement requirements, including a deep dive into the CalFresh Employment and Training Program and information on other qualifying work activities and programs. And finally, we will go over outreach resources that CDSS has released or is in the process of releasing to assist counties and community organizations help individuals meet and understand these new requirements. With that, I will pass the mic over to Lauren and Becca from Arera Health Group to share more about the work they are doing as part of the pilot. Lauren, Becca, take it away.
Thank you so much, Kayla. As Kayla mentioned, we are going to talk a little bit about HR 1. We're going to do a little bit of side-by-side comparison of the CalFresh and Medi-Cal requirements, and then talk specifically about the contours of the pilot that we're working on. Next slide. Okay, so just to make sure we're all centered in the same place for what we're talking about specifically, HR 1 does impose new and expanded work requirements in Medi-Cal and CalFresh. These requirements are focused on ABAWDs, or able-bodied working age adults without who don't have certain challenges to work in the required number of hours, such as people with disabilities or who have responsibility to care for children. So there are slight differences by program across CalFresh and Medi-Cal, and the affected populations. And so we're going to spend a little bit of time covering those differences today. Next slide. So on the Medi-Cal side, the hours that are required are 80 a month. On CalFresh, it's 20 hours a week or 80 hours a month on average. Also, there is a bit of an income difference in terms of it being on a monthly basis for Medi-Cal and a weekly basis for CalFresh. The age range of people impacted is 19 to 64 for Medi-Cal, but it's 18 to 64 for CalFresh. So very close, but not quite identical. The effective date is January 2027 in Medi-Cal, June 2026 in CalFresh. The number of people impacted is different. There is overlap here, but there are a lot more people who are anticipated to be impacted on the Medi-Cal side. Also, the risk of termination of benefits is much higher for higher numbers of people who would be impacted on Medi-Cal. And this risk, just as a point of clarity, is about people who either don't comply and meet the hours needed, or there are just administrative barriers and they don't do the things that they need to do. But either way, these are losses of coverage that aren't don't wouldn't otherwise happen, and that if we're able to take the steps necessary, could keep people covered. I do want to note we do want to make sure that people can ask questions throughout. I see one already. So is there an age range for the children ages for adults caring for children? No, in terms there's an age range for the children, but not for the adults. So the you have to be like it's under 14, I believe. And I also want to invite others from CDSS and to chime in as well. So, and the earnings, they are similar in terms of the other comment that came in, but they are not identical. You can hit one faster than you'd hit the other. And of course, there are people who enrolled in both. And so one might be sort of negated by the other. Okay, next slide. Okay. All right. So this is a slightly different presentation here of it. So 580 a month or 217.50 a week. Again, Medi-Cal being the 580, CalFresh in green here. The qualifying activities that people can participate in so that they can maintain their benefits do include employment, community service, job training or work programs, including work fair, as well as education. And I'm sure there are a lot of questions around this. And the one important point is that the combination of any of the above can work. So somebody might have some employment, some education, some community service, an education, and the way that the things are being calculated, some of that information is still pending, but it's certainly important to think about. I see there are a lot of questions coming in, and so Becca, if you, in looking at any of these questions, want to interrupt me because of relevance for where we are, I'm going to keep going on the deck, but please feel free to take a look and we can answer as we go. So, all right, next slide. So, these slides will be made available afterwards, so I'm not necessarily going to go through every single detail here, but this is specific to Medi-Cal and who must meet the community engagement requirements. So again, it's adults who are eligible for Medi-Cal because of the ACA expansion and then don't meet any of the exemptions. And the exemptions are here on the right. So we have children, older adults, people who are pregnant or 1 year postpartum, regardless of birth outcome. Parents, caregivers, oh, here's the answer to the question that just came in before. Parents, guardians, caretakers, relatives, or family caregivers with children 0 to 13. And so the list goes on here, and these are the specific populations that are exempt from community engagement requirements. And again, there are some details that we are still awaiting from the federal government, but this is the information that we have right now. Next. On the CalFresh side, again, a lot of similarities, but not identical. So the 18 to 64, not having a dependent child under 14, are considered physically and mentally able to work at least 20 hours per week, are not excused from the rule. And then the exemptions here on the right. And so again, very similar, but not identical. And so people who are receiving benefits under both programs have to be compliant with both. Importantly, though, if you are exempt under CalFresh, you are automatically exempt under Medi-Cal. This is perhaps the most simple part of the story and part of the equation here. So that is one important thing to remember. So I see a question here. I was told that workforce could not be combined with other work or community engagement activities. I do not believe that is correct. You can have a combination of activities to meet the requirements. All right, next slide. So here we just made a attempt to put the requirements together so you can see where there is alignment, where there's partial alignment, and where there are provisions that are specific to only Medi-Cal or CalFresh. Sorry, we referred to SNAP here, but CalFresh is the term we should have used in this deck. All right, next slide. And then here again are the like side by side of other key differences. We already talked about the effective date. Look back is something that I haven't talked about yet. So in Medi-Cal, there's going to be a look back to a month prior to application, whereas in CalFresh, it's compliance tracked going forward. At the renewal period, it will be at least 1 month since the last application or renewal, and in CalFresh, it will be ongoing and self-reported if hours drop. So if somebody doesn't self-report, there is an assumption of no change during the period when they would otherwise be receiving benefits and aren't at renewal. Renewal frequency is every 6 months in Medi-Cal, and it's a standard recertification on CalFresh. Verification is also different. There will be an ex parte auto review first. So that means trying to use data and systems as much as possible to determine where renewal can happen. And then there will be a manual process if there's not data available to the state, whereas in CalFresh, it's self-reported and the county verifies the recertification. In terms of non-compliance, there's a 30-day notice and then termination on Medi-Cal, and in CalFresh, there's a 3 month max and a 36-month statewide clock. So again, some similarities and some important differences as well. Okay, next slide. So key takeaways here, there are different look back windows in the way that it works, and that it's not even effective technically a look back period and initial application, at least in the CalFresh. The Medi-Cal renewal standard is somewhat forgiving. At renewal, Medi-Cal only requires requirements in at least one of the 6 months, not every month. Self-reporting is essential in CalFresh. And again, importantly, we are still awaiting guidance from CMS on Medi-Cal and are hopeful that that comes soon. So there is additional clarity. Okay, next slide. So as we think about the populations at risk, there are many folks who are going to be implicated. Some of these populations will have exemptions and some of them will not. So an unhoused individual is certainly a concern that a lot of unhoused individuals may be subject to the community engagement requirements. Some of them may have exemptions, but some will not. People who have limited English proficiency and limited digital literacy as well are likely to face challenges. People who have behavioral health needs and people who have conditions that make it difficult to work, but who don't qualify for an exemption. So for instance, somebody who is in and out of a disability status. And then others who have barriers to employment or work. So for instance, justice-involved populations. I see a question here, what about caregivers? I don't know if that's a question specifically about if they are a population at risk. People who are caregivers will oftentimes be exempt. So they're not, again, it depends on the situation because if a child lives with two parents going back and forth, they can't both be considered the caregiver. So one of them would and one of them would not. So there are nuances there, but these are the populations for which we believe there is a lot of risk. And this, in terms of populations at risk, this is overall across programs where there are concerns. Okay. Becca, anything at this moment before we keep proceeding that you want to chime in on, or any questions you've seen that you want to address?
Not right now. I would encourage folks to keep putting their questions in the chat. A lot of the questions around exemptions and sort of specifics are being answered in the chat. So please be paying attention there, and we will continue to address them as we keep going.
Okay, fantastic. And I am going too fast to some of the feedback. So we will, Becca, I'm going to turn it to you now to talk about the pilots. So maybe if you can go a little bit slower than I am.
Absolutely. All right, so want to talk a little bit about this pilot and how we're trying out kind of innovative solutions to implementation for these new requirements. Next slide, please. So this pilot is really a partnership. California Health and Human Services Agency and the Labor and Workforce Development Agency launched this 7-county pilot in partnership with California Department of Social Services and Healthcare Services, with the idea that this is going to be a pretty Herculean effort to implement these new requirements effectively and keep as many people with access to their benefits as possible. And they selected 7 counties to really test new things, to try different approaches, with the idea of those counties trying things out, learning from them in a quick iterative process, so that things that do work well could be really scaled and shared with other counties across the state. The goals of these pilots, really at the forefront is let's help as many people as possible retain their benefits, make sure that they do have access to the opportunities to meet these new requirements. We want to also make sure that these community engagement activities that people participate in are not purely compliance driven, that in an ideal world, folks are completing activities that actually are moving them on the path towards economic mobility, and so that they're actually meaningful activities. And then also that, as people are testing out these different implementation solutions, that they can be shared with other counties across the state and really contribute to long-lasting change. Next slide, please. So the counties that were selected were really based on trying to get a sort of diverse representation from counties across the state. We're looking at a sort of a mix of rural and urban counties, looking at which counties have the highest impact, meaning the largest percentage of ABAWDs, or the largest number of people that we expect to be subject to these requirements, looking at things like labor and unemployment rate, and also just where there were kind of internal champions and just readiness to actually participate in this pilot. So the counties that were selected were Alameda, Humboldt, Los Angeles, Mariposa, Riverside, Sacramento, and San Diego. And all 7 of those counties are currently participating in the pilot. Next slide, please. So the timeline. We get asked this a lot actually as we've been engaging in this pilot, is around the timeline, what's happening, and we'll talk a little bit about the timeline of the pilot. But just to remind everybody, this HR1 was passed July 4th of last year. It's been almost a year. June 1st, which is right around the corner, is when ABAWD worker community engagement requirements for CalFresh will go into effect. And then January 1st of next year is when the engagement requirements for Medi-Cal will go into effect. So we're really in the process right now of doing as much as we can to prepare for that implementation. Next slide, please. So what does this pilot actually look like? It's really comprised of 4 elements. The first is a community of practice. So we're bringing the different stakeholders from these counties together to learn from each other, to share, to have a place to ask each other questions, learn about things, the kind of different approaches that counties are taking to this implementation. We're also doing site visits with each county where we're actually bringing together representatives from the workforce side, workforce boards, county social services, and adult education, so community colleges and adult schools. We're bringing them all into a room to say, how do you want to approach this in your county? Where are your strengths? Where are your opportunities? What do you want to concentrate on as you look at implementation? And what are the things that you really need to solve for sooner rather than later? Counties will come out of that site visit with an action plan and sort of an ongoing plan for collaboration between those agencies. In support of that action plan, we're also looking at tools and technology. We'll talk a little bit more about this later, but we recognize that a lot of the challenges with implementation that are coming up, some of them just require human power and will require humans to talk to each other and work in different ways. But also when we're looking at the scale of the number of people that will need to complete these requirements, we know that tools and technology will be a huge support if they're done correctly. So we're really looking at technology solutions as well. And then also just technical assistance. A lot of what we've heard from counties, and we'll talk a little bit about this, is a need for more guidance, for actually some support figuring out their plan, looking at different materials that will support their implementation. And so we're looking at a variety of technical assistance. Next slide, please. And I'll pause here for just a minute because I see a question in the chat for this pilot. Are you meeting with the local social services offices only or CBOs as well? It's a great question. Initially, we're meeting with workforce development boards, county social services, and adult education. And as we're creating those action plans, we're really working with those stakeholders to say, who else do you need in the room? Your CBOs are a key partner for a lot of these activities. And so we're really encouraging them to kind of make a stakeholder map actually of their county and draw in their CBO partners, both for things like volunteer opportunities, but also for all, CBOs are working with a huge number of people from this population that will be affected. So really planning to bring those CBOs in as they're creating that action plan. So as part of this pilot, what we did first is we just started talking to all of these folks just to assess, what are you currently thinking about? Like, what are your current plans? What are your concerns? What are you worried about? What do you see as your strengths? And we heard some pretty consistent themes across stakeholders and also across all 7 counties. The first one was really around resource needs. I think this speaks to a lot of the questions in the chat. People are really hungry for more guidance and for specific guidance. So things like this webinar are an attempt to solve for that. But people have also really asked for guidance that's specific to certain stakeholder groups. We know that, for example, the language that the workforce boards is different than the language that the social services offices are using. So people really want lifted that up as a clear resource need. We also really heard from a lot of stakeholders that there's real variance in how much people know about these new requirements. Social services agencies know a lot more in the pilot counties that we talked to. We heard a lot less familiarity from the adult education side and some mixed understanding on the workforce side. Another key theme that we heard was capacity constraints. We really heard a lot from folks kind of across stakeholder groups again that, this is going to be a significant increase in work for certain roles, for certain partners, and that there's just concern here about meeting the need. So this came up a lot around where technology can be helpful, where can we look at creative staffing solutions, but this was brought up across everybody we talked to, really, of just looking at how can we meet this increased need. Next slide, please. Another big theme here, a lot of folks we talked to talked about, hey, we have really strong partnerships in our county, and that can provide a really fantastic foundation. And people also named that a lot of times that those partnerships can be very dependent on a couple of individuals. It could be done kind of ad hoc rather than in a really coordinated or strategic way. And so kind of expanding or formalizing those partnerships will be really critical to meet this need. And related to that, a lot of people talked around data and technology needs. A lot of the systems that these partners use don't talk to each other, right? So when we talk about the systems we use for tracking on the social services side versus the workforce side versus community colleges, these systems do not talk to each other, and people are doing a lot really manually, either via things like spreadsheets or just by picking up the phone or via email. So there's a lot of interest in sort of new tools, ways to get technology to talk to each other, and also ways that might be able to lift the burden off individuals to self-report or to submit their own documentation where we do have data that could actually verify their requirements. Next slide, please. So related to technology, I spoke a little bit about this, just that referral process and tracking. A lot of that, again, is manual. There's very little closing the loop from what we heard. We have a lot of folks talked about making referrals, but not necessarily knowing whether that referral was completed. Making a referral, for example, to a housing organization or between the social services and the workforce boards, but not knowing if that person actually showed up at that next place or got connected to that service. So people really lifted up wanting to look for opportunities to close that loop, to scale referral workflows, and really looking at creative solutions to matching participants to these opportunities. And then lastly, we heard a lot from folks around just the participant or client or customer experience. As we talked about earlier, really looking at who's going to be most at risk or most vulnerable to losing their benefits. These are folks that may struggle to understand the requirements or navigate systems, may have challenges staying engaged. So a lot of concerns around just disenrollment from benefits. And then on the flip side, a lot of folks talked about how we should really be looking towards where are those trusted supports? Where are those trusted advisors within the community? Maybe to the question earlier in the chat around bringing in CBOs, looking at things like also community clinics and where people are already getting information and have trusted relationships. Next slide, please. So one thing that we've been talking with the pilot counties about is, really thinking about the workflow or sort of the process flow of how somebody may experience these new requirements and the steps that they'll need to go through. It looks really linear on this slide, but of course we know it's not always this linear. People may come in and out of this process in different ways. But just as we think about sort of the whole journey here, we know that at the outset, there'll be an exemption analysis, and that happens, a little bit differently, as Lauren spoke to on the Medi-Cal versus CalFresh side. But people will go through a process to identify, are they exempt? From there, if they are not exempt and they do need to meet these new requirements, there is a step that needs to happen to just assess this individual's situation. Meaning, some people may already be completing some activities that actually do satisfy these requirements, but it may not be sufficient. Maybe they're driving for Lyft 5 hours a week. Maybe they're volunteering a couple hours a week. We want to make sure that there's an opportunity for them to really understand their situation and the number of hours that they need to add on to meet the new requirements. From there, they would create some kind of plan for how to meet these requirements, whether it's adding on additional volunteer hours, enrolling in school, enrolling in a work program, but creating that plan for themselves for their ongoing way to meet these new requirements. Some people may do that on their own. They may be able to make those connections themselves, but likely we anticipate for a lot of individuals, they'll need to get referred to a partner organization to help connect them to those opportunities, to actually connect to work, connect to education or training. So likely we will see more folks going into partner organizations, going into their AJCCs, entering into a community college site to actually get that support. From there, they'll start to actually participate in those activities. There's a whole bunch of supports that people may need at that stage. And then, of course, they'll also need to verify that they have been completing these hours. And as Lauren spoke to earlier, that looks a little different on the Medi-Cal and CalFresh side, but they will need to verify that, and they may need support there as well. So just noting kind of throughout this flow, there's multiple places that people could drop off. There's multiple places where people could get confused, and there's multiple places that they may need some additional supports. So really you can start to see from this flow how much this is going to be an effort where it's not going to be just one organization that supports these folks, but needs to really be an effort across organizations. Next slide, please. So as I spoke to, this is going to be a group effort here when we think about all the different types of organizations that kind of touch these individuals or may support folks that are navigating these systems. We're really looking across the stakeholder kind of an ecosystem map. So county social services, workforce boards, Medi-Cal managed care plans have a really vested interest here in making sure people continue to have access to their benefits. Education partners, there's kind of statewide resources. And then, of course, more on the community side, you have community service providers, you have supportive service providers, and then you also have employers in industry and philanthropy. So we have a whole network of different types of organizations that really need to be able to communicate well and have this kind of basic information so that they can support people as they navigate. Next slide, please. All right, so we have mentioned technology tools a couple of times, and I just want to point out that there are some tools that we are exploring as part of this pilot, just recognizing that technology can be one of the answers. And I'll speak to just a couple of them. One is sort of a calculator tool. We understand that actually even understanding the number of hours that somebody might need to complete and the way that they total up, depending on their individual situation, could be pretty confusing. So we're exploring a tool that could help individuals kind of add up the hours that they need in different ways and see how those activities could add up to actually meeting their requirements. The second tool that we're exploring is a learning management system. We know that folks may create a plan where they're going to enroll in training or education, but there may actually be a gap before they can start. Maybe it's the semester, they have to wait for a semester to enroll in school, or maybe they're going through an application process. We want to make sure that there's something that's immediately available to anybody that wants to engage to meet their requirements, to just have something right away. And so we're exploring a learning management system that would have a curated list of courses that we would know would meet these work requirements, that people could participate in right away as soon as that they're ready, and it would meet their requirements in an ongoing way. And then the last thing is a kind of career and education navigator. So just knowing that, again, somebody might say, great, I want to participate in education to meet these requirements. Not always that easy to know which education provider to access, where to find that, what the requirements are for that provider, what's local, and so looking at a tool that can help people assess what's the best fit for them in terms of an education or training program, and then some information about how they can actually connect to that training. Next slide, please. And actually, I'll pause here on the education because I see that Tamara has put something into the chat. You were right. There are a lot of online resources that are available. Workforce boards have access to things like metrics learning. We have CBOs that have access to things like LinkedIn Learning or Coursera. You have the community college system that may have access to online education. Part of why we're looking at kind of unified tool or one tool is to make sure that it does actually meet the work requirements, because there are some nuances in which types of training and education count. And also to make sure that people can just access it on their own in an easy way, and not have to go into a center if they don't have that ability to. All right, so lastly, I'm going to talk about the site visits we're doing with each county. I mentioned these a little bit before, but again, with each of these 7 counties, we're getting workforce boards, social services, and adult education into one room to say, what's your plan going to be here? We're establishing an action team with folks, representatives from each of those types of organizations, to really say, where do you want to concentrate in your county? What does that look like? What are the goals that you need to identify? What are the action steps? And then who are those responsible parties? Who else do you need in the room? And then as part of that, we're also servicing kind of ongoing technical assistance and peer learning needs. A lot of counties have talked about how they want to learn from each other, and really learn how people are approaching it in different places, how they got to that solution, kind of what their considerations are. And so we're really working with each county to identify where are there places they can learn from each other, and then where are there gaps actually in either guidance or technical assistance that we can provide as part of the pilot. And next slide, please. Oh, that's it actually on my end. So I'll pause here and let me just take a minute to look through the chat and see if there's anything else that we can speak to. Oh, I see a question here. When do we anticipate these tools being available? Lauren, do you actually want to speak a little bit to the timeline on tools?
Yes, we are in the process of starting prototyping, and we're going to be working with the pilot counties, but we don't have an exact date yet, so stay tuned. Hopefully, these are tools that you will find useful. Would love to hear that in the chat if these are things that you think will be helpful for folks, but we don't have an exact timeline. We recognize that these requirements are going into effect June 1st, and so in most counties, and so there is urgency. We just need to make sure we get it right. Also, because we are working across CalFresh and Medi-Cal, we're still awaiting some federal guidance that's going to be important to inform how some of these tools work. So, but we know you want them, and we can't get them done fast enough. So.
I'll also pick out just a couple more things from the chat. I see a kind of shout out for the HACCs and workforce. Absolutely. This is, a place where, the HACCs have been providing support for people to connect to employment and training that's their mandate and that's what they do. And so we do anticipate potentially a big influx there of folks that are accessing those services and going into the HACCs for that support. I also see one question in here around, there's been a lot of mentions of community colleges. How are the other public higher ed segments being engaged in this work? Right now, we're really concentrating on talking to the community colleges and the adult schools because we see them as key partners here, both around having availability, meaning they actually potentially have capacity for people to enroll, and also that they're really already serving this population quite a bit and are really well prepared to support this population. If there are other types of education that folks in the chat want to drop into the chat, we would love to hear that. We want to make sure that we're not missing out on talking to key stakeholders, but we're also really leaning into the county and the folks on the action team to identify in their county who are those key partners to make sure to bring them in.
I see there are a lot of questions around sort of what qualifies and tracking of hours. And again, some of this where we're looking across programs, we don't have kind of all of the information yet. So stay tuned, but I'm sure where it does exist, CDSS will get back to you on those specifics.
Yeah, and I maybe just on a last note, I'll call out there's a great question at the end here about referrals. So what is the referral process for individuals who are losing benefits and need help accessing this type of support? That question is basically why this pilot is happening, because right now that referral process looks really different in every county. And what we see is that it really depends on the individual worker. We see education often missing from that referral process. And so we're really working with the action teams in each of these counties that are participating in the pilot to say, how are you going to do these referrals in a coordinated way? How are you going to make sure that folks are getting connected if they are at risk of losing their benefits? And how do you make sure that they're actually getting referred to an organization that has the capacity to serve them, right? We do not want folks getting referred to a service or an organization that actually, is full, doesn't have capacity to serve those individuals. So it's a big part of or focus of the pilot.
And I know there are still questions coming in, but we are at our overtime at this point, so I do want to turn things back to Kayla.
Thank you so much, Lauren and Becca, for that overview of the pilot programs and providing context of this new landscape. I believe they both will be sticking around to help answer some additional questions that are coming in. So, as a reminder for folks, if you do have questions about anything that Arera shared or any of the remaining presentation, please place those questions in the Q&A box. The team at CDSS is answering them as they come in, and if we have time at the end of the presentation today, we will go over some of those answered questions as well. But let's transition now into more details on how individuals who receive CalFresh and are considered ABAWD subject to the time limit can meet their work and community engagement requirements through qualifying activities. As we all know, able-bodied adults without dependents, or ABAWDs, who are subject to the time limit must satisfy the work and community engagement requirement to maintain CalFresh eligibility. There are several pathways for individuals, including employment, attending school, or participation in a qualifying work activity or program. So let's talk a little about these individually before going into program or activity specific criteria. As a reminder, counties must verify hours of employment or participation in a work activity and/or program at certification, recertification, and potentially during the certification period based on reported changes. The only exception to verifying hours at those time periods is in relation to workfare. Workfare hours must be verified every month. First, let's review employment. Employment for at least 20 hours per week, or 80 hours average monthly, satisfies the work and community engagement requirement. Employment hours may be combined with other allowable work activities described in this section to satisfy the work and community engagement requirement. Now let me pass it to my colleague, Amy, to discuss how attending school can be a qualifying activity. Amy?
Thank you, Kayla. Can you hear me okay?
Yes.
All right. Hello, everyone. I see some questions coming into the Q&A about education, and so hopefully I can alleviate a couple of those questions through the next couple of slides. So another way that ABAWDs can meet work and community engagement requirements is by attending school. As Becca mentioned earlier, there are some nuances to when education can be used to meet ABAWD work requirements. So first, let me preface by explaining what a CalFresh student is. I saw a question in the chat specifically about this. These are students age 18 to 49 who attend an institution of higher education at least half-time. CalFresh students must meet an exemption from the student eligibility rule to receive CalFresh. CalFresh students are never ABAWDs because they're exempt from work registration. The exemptions that they meet to be exempt from the student eligibility rule and eligible students is also a work registration exemption, and therefore they're never ABAWDs. But there are students who are not CalFresh students. They might be attending school less than half time or taking non-credit courses like GED or ESL. So these students may be ABAWDs. When one of these students is attending school as part of a work program, such as CalFresh ENT, a WIOA program, or a local program that increases employability, we call these LPIEs, their school attendance hours can be counted toward ABAWD work and community engagement requirements. Next slide, please. So a list of thousands of local programs that increase employability is on the CDSS website under CalFresh Resource Center Policy Guidance. ABAWDs participating in any program on that LPIE list can count their school hours towards ABAWD work requirements. ACL 2625 expanded the LPIE list to include all associate and bachelor's degree programs at California community colleges, California state universities, and the University of California effective June 1st, 2026. Under this change, there are tens of thousands of LPIEs and any ABAWD participating in one of them may use their class time as ABAWD participation hours. So say you have an ABAWD participant who's taking one class each semester, slowly working towards their associate degree at their local community college. They're not attending half-time or more, so they're not a CalFresh student. So they may be an ABAWD. If they don't have any other exemption from work registration and don't have any exemption from ABAWD work requirements, they have to meet those work and community engagement requirements. Because they're in an associate degree program at a public institution, that is an LPIE, and their school attendance hours can be counted towards meeting their 20-hour-a-week ABAWD work requirements. I'm going to turn it back over to Kayla to move us forward, and I will address any of your questions in the Q&A.
Thank you so much, Amy. Continuing down the list of qualifying work activities and programs. These activities and programs include CalFresh Employment and Training, Extended Foster Care, or EFC, and Independent Living Programs, ILP, work programs under the Workforce Innovation and Opportunity Act, also commonly referred to as WIOA, a program under Section 236 of the Trade Act of 1974, and community service or volunteer work. So let's review these work activities and programs in more detail. We'll start by taking a deeper dive into the CalFresh Employment and Training Program, also referred to as CalFresh ENT. Employment and Training, or ENT, is the workforce development arm of the SNAP program. SNAP, of course, is called CalFresh in California. Our vision and mission for the program is to increase the employment and earning capacity of CalFresh recipients by providing access to ENT services and supportive services, ultimately resulting in skills upgrades and credentialing opportunities. Participation is voluntary for CalFresh applicants and recipients. CDSS provides direct oversight of the CalFresh ENT program and is administered locally by counties, tribes, and tribal organizations. Counties, tribes, and tribal organizations that choose to administer a CalFresh ENT program are also referred to as program administrators. Program administrators are not only given the option to administer a CalFresh ENT program, but are also given the flexibility to design programs to meet the needs of their local populations and economies. In designing programs to meet the needs of their local populations and economies, program administrators may choose to tailor services to priority populations. These priority populations include, but are not limited to, able-bodied adults without dependents, English language learners, formerly incarcerated, general assistance or general relief recipients, people experiencing homelessness, single parents, students, timed out CalWorks participants, and veterans. Each year, counties, tribes, and tribal organizations can elect to opt in to offer a CalFresh ENT program. For federal fiscal year 2026, 35 out of California's 58 counties offer a CalFresh ENT program. CalFresh ENT can only be offered as a way to meet the work and community engagement requirement if the ABAWD subject to the time limit resides in a county that administers a CalFresh ENT program. In federal fiscal year 2025, CalFresh ENT served approximately 108,000 participants. The breakdown of these served constituted of 68% male and 32% female. 22% of all participants were ABAWDs. 5% identified as an English language learner. 66% of participants did not have a high school diploma or GED. And the breakdown of age, 44% of participants were aged 18 to 35, 37% were aged 36 to 49, and 19% were aged 50 or older. CalFresh ENT is funded by the Federal Employment and Training Grant, and funds are allocated annually by the U.S. Department of Agriculture, Food and Nutrition Administration, or FNA, previously known as FNS. Each state receives a portion of what is called administrative funds, or 100% funds. For federal fiscal year 2026, California received $12 million in administrative or 100% funds from FNA for the administration of the CalFresh ENT program. Because California is locally administered, these allocated funds are then split between program administrators, so the counties, tribes, and tribal organizations that opt into the program. In addition, program administrators can use other non-federal funding to administer their ENT program. Non-federal funds used for administrative costs or participant reimbursements may be eligible for 50% reimbursement. Those 50% reimbursement funds can either be reinvested into the ENT program or used for other purposes. Note that tribal governments or organizations providing ENT services can get 75% reimbursement, including for participant reimbursements. However, for federal fiscal year 2026, all reimbursements were at the 50% level. Let's take a look at participant reimbursements, also known as supportive services. So participant reimbursements play a crucial role in helping participants remove common barriers to getting or keeping employment. CalFresh ENT programs must provide participant reimbursements to its participants that are reasonable, necessary, and directly related to participation. Common participants' reimbursements include transportation assistance, like bus passes or gas cards, work-related expenses like uniforms and tools, payment or training and certification fees related to employment or the engaged activity, childcare expenses, education materials, housing assistance for up to 2 months, and other supportive services based on local needs. To assist in service delivery, CalFresh ENT program administrators can choose to partner with community organizations to help run their program. These partnerships help organizations reach a larger number of participants. ENT partners can include organizations such as community and technical colleges, employers, local workforce development boards, nonprofit and community-based organizations, social enterprises, and WIO's service providers. Additionally, CalFresh ENT holds contracts with entities known as state partners. Our first state partner is Fresh Success. Fresh Success is a program offered through the Foundation for California Community Colleges. The Fresh Success program helps low-income Californians access educational programs to build skills and attain degrees, certificates, and credentials. The Fresh Success program connects participants to community colleges, community-based organizations, and education centers. Participants receive a range of comprehensive supportive services as well as career counseling, interview training, job placement, educational plans, academic monitoring, tutoring, and case management. Fresh Success currently offers services in 17 participating CalFresh ENT counties. Our next state partner is Centers for Employment Opportunities, also known as CEO. CEO offers immediate, effective, and comprehensive employment services exclusively to individuals who have recently returned home from incarceration. CEO operates an evidence-based program that combines training with in-depth, hands-on work experience. The program is designed to align with employer needs, helping participants develop the skills necessary to obtain careers CEO offers services in 10 CalFresh ENT counties. Before we talk more about the CalFresh ENT program, or how the CalFresh ENT program can help ABAWD subject to the time limit meet the work and community engagement requirement, throwing in a quick plug that although we are not quite done with federal fiscal year 2026, we are already in the annual planning stages for federal fiscal year 2027. Our All-County Welfare Directors Letter, or ACWDL, has been posted online, which provides an outline of the planning process, timeline, and plan templates and instructions for program administrators. In addition to the ACWDL, we have uploaded informational webinars to our YouTube channel to assist with this process. One-on-one technical assistance for program administrators who have opted in to administer or are interested in administering a CalFresh ENT program is available. If your county, tribe, or tribal organization is interested in administering a CalFresh ENT program but has not yet opted in, please reach out to calfreshent@cdss.ca.gov as soon as possible. Now, let's talk about CalFresh employment and training components and activities and how these can be used to help ABAWD subject to the time limit meet their work and community engagement requirement. Before diving into the components, please note that a CalFresh ENT program must consist of both case management and one or more ENT components. Case management is essential to guiding and supporting participants towards appropriate components and activities based on the participant's needs and interests in order to help a participant's employment goals. Case management can be provided by the program administrator or partner. Forms of case management include comprehensive intake assessment, employability assessment, individualized service plan, progress monitoring, and coordination with service providers. In CalFresh ENT, a component is just defined as a service, activity, or program designed to help CalFresh recipients gain skills, training, or work experience that will increase their ability to obtain regular, unsubsidized employment. To satisfy the ABAWD work and community engagement requirement, participants must engage in at least one qualifying component. In CalFresh ENT, education, job retention, self-employment training, job search, work experience, and workfare are components that can satisfy the work and community engagement requirement. Noting here that supervised job search and workfare are denoted with an asterisk. This is because there are special nuances to these components to take into consideration when CalFresh ENT is used as a way for an individual to meet their ABAWD work and community engagement requirement, which we will outline when we review these components individually. Let's dive into more about each of these components, starting with education. The education component includes a wide range of activities that improve basic skills, literacy, and employability. All education activities must have a direct link and help participants move promptly into employment. Allowable education program activities include the following: adult basic education and/or foundational skills instruction, career and technical education and/or vocational training, English language acquisition, integrated education and training or bridge programs, and work readiness training. The job retention component provides case management and supportive services to participants for a minimum of 30 days and a maximum of 90 days after employment is secured. As mentioned earlier, supportive services or participant reimbursements may include assistance with transportation, childcare, and ancillary items such as uniforms and tools needed for employment. Only individuals who receive services under another qualifying CalFresh ENT component before obtaining the new or improved employment are eligible for job retention services. In CalFresh ENT, time spent in case management counts towards the hours required to meet a work and community engagement requirement, which is how the job retention component is considered a qualifying activity under the CalFresh ENT program. Self-employment training improves participants' employability by providing training in opening and operating a small business or other self-employment venture. Self-employment options include gig employment, which is defined as a single project or task for which a worker is hired. Freelance work, which is often used to apply to more skilled and long-term projects. Freelancers apply their skills or talent on a pay-for-service basis outside of a regular employer-employee relationship. Examples of freelance include web design, writing, repair services, landscaping, or personal fitness coaching. And finally, starting a business with a physical location and/or employing others to make or sell goods or provide services. Next is supervised job search. Job search activities must demonstrate a link to increasing the employment opportunities of individuals engaged in this activity. Activities under this component may include, but are not limited to, job search training, master application, mock interviews, and resume development. Job search, supervised or unsupervised, is not a qualifying activity for ABAWDs unless it is completed through one of the following programs: a WIOA program, certain Trade Act programs, and certain programs for veterans. Supervised job search is considered a qualifying activity under the CalFresh ENT program so long as it is offered through one of these programs listed. As a reminder, rules stipulate that job search can count for no more than half of an individual's ABAWD hours. The work experience component is designed to improve the employability of participants through actual work experience or training, or both, and to enable individuals employed or trained under such programs to move promptly into regular employment, either public or private. It is a planned, structured learning experience that may be paid or unpaid. Work experience hours are calculated by the CalFresh benefit allotment divided by the highest applicable state, federal, or local minimum wage. Work experience activities include work activity. A work activity program is performed in exchange for CalFresh benefits that provide the participant with an opportunity to acquire the general skills, knowledge, and work habits necessary to obtain regular unsubsidized employment. The purpose of work activity is to improve the employability of those who cannot find unsubsidized employment. Participants can also engage in work-based learning. Work-based learning activities are sustained interactions with industry or community professionals in real-world settings or simulated environments at an educational institution that fosters in-depth, first-hand engagement with the tasks required in a given career field that are aligned to curriculum and instruction. It is important to note that CalFresh ENT participants who are also considered ABAWDs can combine any of the qualifying components or activities we just went over to meet the 80-hour per month requirement. However, Workfare provides an exception to the 80-hour per month work and community engagement requirement. So let's talk about Workfare. The goal of Workfare is to provide increased opportunities to improve employability and support ABAWDs in moving into regular employment. In Workfare, individuals work or provide a public service in exchange for public benefits. Workfare can be used to meet the general work requirements or to satisfy the ABAWD work and community engagement requirements. Please note that individuals can only be assigned to one workfare program. Workfare hours belong to the household, not an individual. If a household has more than one ABAWD, they may divide the hours however they choose. For example, one person can complete all hours required, or members can split them in any combination. Please note that there are limits on hours worked. Workfare hours cannot exceed 30 hours per week, 8 hours per day. Well, that's backward. 8 hours per day, 30 hours per week, or 120 hours per month. The number of hours required in workfare to meet the work requirement is calculated by dividing the household's CalFresh allotment by the highest applicable federal, state, or local minimum wage, meaning the hours to comply via workfare are significantly less than those through other qualifying activities. Let's look at some examples on how to calculate the number of hours an ABAWD would need to participate in workfare in order to meet their work and community engagement requirement. In example one is a one-person household. The one adult in the home receives $298 in CalFresh benefits. They reside in Fresno County, and the minimum wage for that area is $16.90. So we take the $298 of the CalFresh benefit and divide that by the minimum wage of $16.90, and we get an uneven number of 17.63 hours. Workfare allows us to round down that number. So for this individual, they would need to participate in a workfare activity for 17 hours per month to meet their work and community engagement requirement. And just noting that the fraction of remaining hours does not carry over to the next month. Now let's look at a two-person household. So the two adults in this home receive $546 in CalFresh benefits. They currently reside in San Francisco County, which has a minimum wage of $18.67. We take the CalFresh benefit allotment, which is $546, and divide that by the minimum wage of $18.67, and we get a number of 29.24 hours. Using workfare rules, we can round that number down to 29 hours per month for the household. And as a reminder, those hours can be split between the two individuals how they see fit. So they can either split the hours or it can be completed by one member of the household. If an individual chooses to engage in the workfare component and are considered an ABAWD subject to the time limit, counties must notify the participant of the workfare requirements through an informing notice. The notice must include the case name and case number, names of all workfare eligible household members, the household address, the certification period, an indication of any part-time work the individual is already performing, where and when the participant is to report, the person or office to whom the participant is to report to, a brief description of the assigned duties, and the number of hours to be worked. Workfare can be completed on any public or private nonprofit organization. Regulation emphasizes that workfare cannot be completed at a for-profit organization or private employer. Agreements must be established between the county and the organization providing workfare that include but are not limited to the number of slots available and assigning responsibility for providing benefits and services to workfare participants per 7 CFR 273.7 M32. The county must have a formal contract with all workfare sites, monitor compliance, monitor those sites for compliance and safety, interview and assess potential participants, and assign each individual to an appropriate workfare placement. Counties must ensure that individuals participating in workfare are treated fairly and equitably with the same rights, protections, and working conditions provided to regular non-workfare employees performing similar tasks. This includes, but is not limited to, workers' compensation coverage, equal and safe working conditions, standard health and safety protections, and protection from discrimination. These requirements help ensure that workfare participants are not exploited, placed in unsafe environments, or treated differently from other workers at the same site. Counties must ensure that workfare participants do not replace or displace regular or paid employees. Workfare is designed to help participants build marketable skills, gain experience, and support their path to employment, not to fulfill essential business functions. Workfare assignments should supplement, not supplant, an existing workforce, and sites should never rely on workfare participants to maintain normal operations. Now that we've covered CalFresh ENT in depth, let's revisit the other qualifying work activities and programs in more detail. As mentioned earlier, the other qualifying work activities and programs mentioned include extended foster care and independent living programs, Workforce Innovation and Opportunity Act activities, programs under Section 236 of the Trade Act of 1974, and community service or volunteer work. Certain activities completed by youth in or leaving foster care may count toward the ABAWD work and community engagement requirement. Participation in extended foster care may be treated as meeting the ABAWD work and community engagement requirement when the activities align with allowed work activities under Title VII CFR 273.24a. Extended foster care eligibility, which is for foster care ages between ages 18 and 21, requires at least one of the following: attending school in high school or post-secondary, working at least 80 hours per month, engaged in a program to reduce barriers to employment, or having a medical condition. Independent living program or transitional independent living plan activities. Older foster youth may participate in these services and activities that prepare them for adulthood and employment. Examples of independent living programs and transitional independent living program activities include, but are not limited to, extended foster care, WIOA Youth or America's Job Center of California programs, California Opportunity Youth Apprenticeships, volunteer and leadership programs, continuous quality improvement activities and listening sessions, Job Corps, Volunteers in Service to America, Ticket to Work, and I Foster Job Program for transitional aged youth. The workforce, next, we have the Workforce Innovation and Opportunity Act activities. WIOA activities help people get the skills they need to find good jobs and start careers. It also helps connect employers with workers who have the right skills to succeed in today's economy. Activities under this program include job search, resume workshops, job fairs, referrals, and trainings. Next, the Trade Act, reenacted on December 22nd, 2023, applies to workers identified by the Employment Development Department as adversely affected by U.S. trade agreements, such as the North American Free Trade Agreement, commonly referred to as NAFTA. The Trade Act provides training services to adversely affected workers through participation in programs that are subject to approval by the Secretary of the U.S. Department of Labor. Programs include supervised job search, on-the-job training, WIOA training, or remedial education programs. And finally, an ABAWD may also choose to do community service or volunteer work to meet the required hours. For this option, an authorized representative of the organization must verify the hours worked by the ABAWD. Counties may use the optional CF 888 to obtain this verification. Participants may complete community service at a nonprofit or public institution of their choice, including religious or community organizations, as long as the county can verify their hours. To assist counties and individuals in understanding these work and community engagement programs, activities, and subsequent requirements, the CDSS team has put together some resources to help with outreach and furthering knowledge related to these requirements. First, please note the release of ACL number 2629, CalFresh Able-Bodied Adults Without Dependents Time Limit Handbook version 3.0. The handbook provides updated guidance on the CalFresh ABAWD time limit policy. Effective June 1st, 2026, this guidance supersedes the guidance released in the previous CalFresh ABAWD Handbook 2.0. The handbook includes a general overview of the ABAWD time limit, guidance on ABAWD exemptions, and how ABAWDs subject to the time limit may maintain CalFresh eligibility by satisfying the work and community engagement requirement. Next, ACL number 2593 provides guidance on significant changes to policy related to the ABAWD time limit rule due to HR 1. A subsequent errata, ACL number 2593E, was released as well. The revision in this letter aligns previously communicated guidance with updates made to the Supplemental Nutrition Assistance Program Quality Control Review Handbook, or the Food and Nutrition Service Handbook 310, which went to states by FNS, was sent to states by FNS on January 13th, 2026. Additionally, CDSS has developed a digital outreach toolkit with ready-to-use resources and templates to help effectively inform and engage with community members about the changes to the work and community engagement requirements. The ready-to-use resources and templates include a table of contents, a flyer, a fact sheet, frequently asked questions, social media templates, images, and best practices, and a checklist for community-based organizations. The toolkit will soon be available in all CDSS threshold languages and will also soon be available in color and grayscale templates. The entire toolkit is available on the CDSS ABAWD resources page. In addition to this ABAWD series, the CDSS has partnered with the California Community Colleges Chancellor's Office to provide a webinar series on how the California Community College system can continue to support CalFresh recipients with meeting their work and community engagement requirement. The first webinar will take place on May 27th, 2026 at 11 a.m. with a following webinar scheduled for July 29th, 2026 at 11 a.m. This information can also be found on the resources page. Additionally, CalFresh ENT has released a request for information. Due to the changes in the ABAWD time limit policies, CalFresh ENT recognizes the increased demand of work and employment services for CalFresh recipients. CalFresh ENT has compiled this RFI to further assess the capacity and readiness of workforce service providers interested in partnering with CalFresh ENT. Information gathered through this RFI will inform CDSS's contracting strategy for intermediary and direct service providers through a multi-county partnership. Here's a rundown of the timeline for the RFI. The RFI was released last week, Wednesday, May 13th. This Thursday, May 21st, we will be hosting a CalFresh ENT informational webinar. The final date for submissions of questions related to the RFI is Friday, May 29th. And the final date for RFI submissions is Friday, June 12th. To support organization responses to the RFI, CalFresh ENT will be conducting that informational webinar. The webinar will cover the purpose of the RFI, CalFresh ENT basics, and partnership options for service delivery. Organizations who are interested in attending the CalFresh ENT RFI webinar must email calfreshlent@dss.ca.gov. Questions or inquiries for this RFI, as mentioned earlier, is Friday, May 29th, and the deadline for responding is Friday, June 12th. Again, all questions and inquiries related to this RFI should be sent to calfreshlent@dss.ca.gov. Now, I know we are close to the end of this segment today. But let me see if we can answer any questions. So we only have time for a few questions. So bear with us as we pull some from the Q&A box. We did have somebody ask, do volunteer hours need to be tracked monthly? And we did answer that no, volunteer hours are only verified at initial application and recertification. We have another question. Can a client be ABAWD exempt for making federal minimum wage at 20 hours a week or 80 hours per month? The answer is no. Wages are not used for the ABAWD work requirement. They may be exempt from work registration if they earn $217.50 per week, which is the federal minimum wage of 30 hours spent in working, which would exempt them from being considered an ABAWD. Another question, if a parent with a child between 14 and 18 years of age does not meet the community and engagement requirement and is discontinued, will benefits for the children also be discontinued? And the answer is no, the child may still receive aid. Another question, if a customer is completing volunteer hours, they do not need to provide the verification monthly if they are not at the same organization. And the answer, If volunteer work or community service is ongoing, verification is only required at initial application and recertification. If it is a one-time activity, the ABAWD must provide additional verification showing how they will continue to meet the work requirement after the volunteer work or community service ends. Another question, do we collect the last 6 months of proof, or can they verbally tell us that they completed their working community engagement requirement? And the answer is no. Monthly verification is not required. Recipients only have to report when their work hours drop below 20 hours per week or 80 hours average monthly. A question, is there any thought about using a phone-based app for educational opportunities like CellEd? And the answer is yes, digital learning tools can be considered. And I think that is all we have time for today. We really appreciate you all joining us for this webinar series. If you have any questions related to ABAWD policy, please reach out to the CalFresh policy team. If you have any questions or or in need of technical assistance related to CalFresh employment and training, please email us at calfreshent@dss.ca.gov. Thank you, and I hope you all have a great rest of your day.